Deputy Cassells.
Thank you. Thanks very much, Can Corlin. I appreciate you facilitating the debate as well. Can I first of all congratulate Minister Dáil, a very fine advocate, and I wish him well in his work. And I want to commend also his predecessor, Minister McEntee, as well, for all the work that she did. I want to commend my colleague, Deputy James Browne, for all of the work he has done in this particular bill, and indeed pay tribute to all of those in the House who have been advocates, Deputy Tom Neville, Deputy Pat Buckley, and all who have contributed in a very positive and unified way. I think it's important to note that and the ideas that they have brought forward. I want to echo, Can Corlin, what Minister McHugh said earlier in his commentary as well. And he spoke about the pressures on young people from social media, from electronic media, the simple thing of him talking to his father and having that line of communication open as well. I think it's important as well to acknowledge the pressure as well that are on parents as well, trying to understand that dynamic and that change, and maybe the helps and supports for them, because a lot of parents aren't aware of the pressures on their own children. And I'm not just talking about teenagers. Minister McHugh spoke earlier about teenagers in terms of very young children as well, and their exposure to all of those pressures as well, and the helps and support that are required for parents in that sphere. Because there was a comment made earlier during the debate, if only we knew, or if we only... There's a lot of help and understanding that's required there for those who are guardians and parents for our children as well. Can Corlin, I fully believe that there's a real firm commitment on behalf of the Minister and indeed Government and all parties to achieve real progress in this sphere. A very genuine commitment and willingness to work across. What I think is frustrating is that the good work that the Minister, Government and the House do is sometimes not replicated by the delivery services on the ground, in particular from the HSE, which is hugely frustrating. This time last year I spoke in the House in respect to the services in my own county and pressed it hard here in the Chamber to see that those services would be retained. And it is very frustrating that 9 months on from the closure of the acute psychiatric unit in Our Lady's Hospital in Navan, that there is still not a fully operational mental health day service in that hospital. Now, the closure last September was part of a plan to provide a centralised acute service at Our Lady of Lourdes Hospital in Drogheda, something I disagreed with, but it was something that was planned. And I think that when we have a situation that following the closure of the unit in Navan, a mental health day hospital was open in that space so that some local supports would still be available, but that the HSE has admitted now that it still does not have the full-time staff or facilities in place for this service to operate is extremely disappointing. And I know that the head of mental health services in our counties has admitted that, and that there is still no plan yet to see that 9 months after the closure, to see that. I think that's the frustrating thing, that there's a willingness here, there's a determination by all sides, but the reality on the ground is not matching up to that. And the fact that I raised this in the House with the then Minister a year ago, and that 9 months on, that service is still not in place, is deeply frustrating. Minister, I would ask you to look into that. I wish you well in your role, and I hope that real change actually does happen. But I would highlight that again, that if that's the situation on the ground, where a mental health day service cannot be operational 9 months after the closure of a unit, there's a disjoint there between the policy and the reality on the ground. Thanks, Can Corlin.
Thank you, Deputy Cassells.